I'm Martin, and this is my final head to toe assessment. Can you scan the room for me? So after that step, before coming into interaction with the patient, I'm going to check the patient's chart, wash my hands, and after that, I'm going to walk in, provide for privacy, and identify my patient with two identifiers. So, hello, I am Martin. Can you confirm your name and date of birth for me?
Coistola 11/23/98.
And I'm going to use an identifier. Okay. Hello, I'm going to be conducting a head to toe assessment. What brings you in today?
I need an annual checkup.
Are you in any pain?
Not that I know of.
Okay, if the patient would have been in any pain, I would have done the PQRST method. Okay, so now that that's out of the way, I'm going to explain to you the entire process. Do you want me to conduct this assessment for you?
Yes.
I've gathered consent from the patient. Okay, so throughout this assessment, I'm going to be assessing your movement. I'm going to be asking you several questions, and you're going to perform several actions for me. Okay? Okay. So, upon inspection, first I can tell that the patient has skin tone consistency throughout her body. Of course, I do note tattoos and piercings in both ears and in the nose. However, there are no signs of infection from the tattoos or the piercings. And as I said, it's consistent throughout with pink undertones. Have you had any traumas to your head? Any frequent headaches? Do you have any allergies? Do you have any diminished hearing? Any blurry vision?
Nope.
Do you have any trouble swallowing?
Nope.
No? Okay. Do you know where you are at?
Baker College.
You know the season.
It is supposed to be spring.
This why. Do you know who the president is?
That's Donald Trump.
So, patient is alert and oriented. They seem to have a logical thought process. They're answering all my questions throughout. And they do seem to be dressed appropriately for this examination. They do not appear to be in any respiratory distress. They appear to have appropriate hygiene. They are relaxed. She is aware to the situation, doesn't have a flat affect. It's appropriate for the situation. And just some further things. The ears line up with the outer corners of the eye. Her face is symmetrical. No, her nose is not deviated. Her eyes are equal, symmetrical too. Her eyelashes and eyebrows are equal. Looking at the lips, no signs of cyanosis. Weak and moist. Okay, so now I'm going to palpate your skull. Do you feel any pain at all? If you feel any pain throughout, please let me know, okay? So, upon palpation, hair is evenly distributed and it does seem healthy. One other thing, head is normal cephalic. Now I'm going to palpate your temporal arteries. +2 equal bilaterally. Temperature, she is warm. Now I'm going to palpate your lymph nodes. Do you feel any pain? Now I'm going to push on your pinna and push on your tragus, pull on your pinna, and push on your mastoid. Did you feel any pain when I did any of those steps? Okay. Now I'm going to post-auricular, now the occipital. Okay, now I'm going to do superficial, tonsillar, submandibular, submental, posterior cervical, supraclavicular. I'm going to assess for skin turgor, No signs of tenting or patient seems to be well hydrated. Deep cervical. And now I'm going to assess your thyroid. Go this way. And then you swallow for me. And on the other side. You swallow. Okay. The thyroid is intact. It's not deviated. Okay, now I'm going to palpate your carotid. +2. Now I'm going to auscultate the carotid artery with the bell for any roots or murmurs with the bell side. Every time when I do this, you take a deep breath and hold on your expiration, okay? Take a deep breath for me. All right. Again, the same process again, okay? No signs of heart murmurs. And no breweries noted. Okay. Now I'm going to conduct Perla. So pupils are round is equal. Number 4. I'm going to come up the light to see if they react to light. Pupils are reactive to light. Now I'm going to test for accommodation. I'm going to bring this pen in and you follow it, okay? Patient has accommodation. So again, you don't have any trouble seeing or anything. Cranial nerve number 2 is in check. Now I'm going to assess your nose. Can you do this? So you have no allergies or any smelling problems? Okay, now I'm going to palpate your sinuses. Cranial nerve number 1 is in check. Now I'm going to use the pen light. Nose is pink and moist. Hair is evenly distributed. I'm going to see for any perforations or if the light deviates. To the other side. Okay. No perforations noted. Now I'm going to inspect your mouth. Again, your lips are moist. No signs of cyanosis. Okay. Did you say ah?
Ah.
Say like tongue. Tongue is midline. Say out one more time. Uvula and soft palate rows. Pharyngeal wall. Mucosa. All pink and moist. Yeah. Okay, tonsils are +1. Everything, the gums and pharyngeal wall, the buccal mucosa, uvula, and the soft and hard palate are both pink and moist. No lesions or any foreign bodies present. So now for your ears, no signs of drainage. No excessive cerumen buildup. Again, the piercings on your ears. Okay, no excessive cerumen buildup or any, foreign bodies, or no drainage. That's the word, no drainage. So now I'm going to assess your face sensations. But first I'm going to palpate your ears one. assess your TMJ. You go ah. Okay. No signs of crepitus there. Now I'm going to assess your face sensations. Close your eyes for me to tell me if it feels sharp or soft. Okay? And you tell me where you feel it.
Soft cheek.
Okay.
Shirt, forehead.
Mm-hmm.
Soft cheek.
Okay, cranial nerve number 5 is intact. You can open your eyes now. Okay, can you raise your eyebrows? Smile. Puff up your cheeks. Frown. Okay, cranial nerve number 5 is intact. Smile, frown, puff up your cheeks. Raise your eyebrows. Guess I'll just back to that. Maybe it'll come back to me. Okay. I'm going to test your range of motion. Okay, you use this. Okay, I'm going to push down. Do this. Okay. Range of motion, let's say. What resistance? Okay. Okay, again, patient is warm, no limitations to range of movement. Okay, yeah, normal cephalic. Okay, well, yeah, no normal findings there. I think I'm going to move on to your upper extremities. So, would you palpate? Okay. Again, upon inspection, patient has skin consistency throughout. No signs of crepitus. Now I'm going to percuss your lung fields. Can you lift up your shirt for me? Okay. Now I'm going to percuss. Sorry.
You're fine.
Can you move your breast for me? Thank you. Okay. Thank you.
Mm-hmm.
This side. You got a cough going on there.
I was
Are
trying
you
to clear
okay?
my throat.
Okay.
I went down the wrong pipe.
You're not sick, are you? No?
No, my
Okay.
saliva's choking me.
Okay, now I'm going to auscultate with the diaphragm. Okay. Each time I place my stethoscope, take a deep breath, okay? And
Okay.
if you ever get lightheaded or dizzy, tell me.
Is it gonna be cold? Holy.
Okay, it should be warm now. Okay. Take a deep breath. Thank you. I did not hear any adventitious sounds. Patient was not in any respiratory distress, and they were not using any accessory muscles, no heaves or lifts noted. Now I'm going to move on to the back. starting with the bony prominence right here, C7. Just move down to the bottom of the scapula on T6, T7. Move down to T10 and then towards the sides to T6 and T8. Okay. So I'm going to inspect the back first. Patient is warm. I would note these dimples over here just for future reference. No signs of lesions present at all. Skin is consistent and appropriate for their ethnicity all throughout the back. Now I'm going to palpate for any crepitus, any air bubbles. Feel any pain at all?
Mm.
Okay. Now I'm going to percuss. Okay. Again, I'm not going to percuss on any bony landmarks or prominences like the vertebrae or the scapula. Sounds were tympanic all throughout. And now I'm going to assess for AP diameter. You look down for me. Like this.
You want to lift it up?
Yeah. So just okay. Roughly about 1 to 2. Now I'm going to assess for tactile fremitus and symmetrical expansion. So can you take a deep breath for me? So there was symmetrical expansion present. Now for tactile fremitus, whenever I place my hands on your back, can you say 99 for me?
Mm-hmm.
Okay?
99, 99, 99, 99, 99.
Okay, vibrations diminished the further I went down in lung fields, which is a normal finding. Now I'm going to auscultate for your apical pulses, starting with the pulmonic left sternal border, second intercostal space, aortic, and then pulmonic to the right sternal border, second intercostal space, and then Erb's point, which is left intercostal space, third intercostal space, the clavicular line, and then tricuspid, which is to the left intercostal space, fifth intercostal space, and then tricuspid, which is the clavicular line. Okay. I'm going to listen with the bell. Starting here, let's take a notch, take a here. No sounds of bruise present. S1 and S2 were present. Heart rate was regular and consistent. Right, you can put your shirt back on. Okay. Now I'm going to assess the abdomen and the lower extremities. Okay, upon inspection, contour is flat. The piercing here. Did you have it redone?
Yeah, I got it redone.
Okay, so
A little scar tissue.
skin is warm. Well, a little cold on the sides, but
It's a table.
skin color is appropriate throughout. I don't see any masses. So normally we would follow IPPA, which would be palpate and percuss, but I don't want to make a storm in your stomach, so I'm going to start off by auscultating your
Alrighty.
4 quadrants with the diaphragm. Okay. Okay, bowel sounds are present in all 4 quadrants. Now, I'm going to palpate for the purpose of this, well, percuss. No, okay, for the purpose of this video, I just wanted to mention I would do deep palpations as well. That's why I'm confused. But for the purpose of this video, I'm only going to do light palpations. But for now, I'm going to percuss. Okay, sounds were tympanic all throughout the quadrants. Again, as I mentioned, I'm going to start off with light palpations, but I'm not going to do any deep palpations. Do you feel any pain or tenderness?
Mm-mm.
Okay, now I'm going to auscultate the renal, renal and iliac arteries. The back, oh, sorry, on that side. Starting off the renal. Now for the iliac. Oh. Right iliac. Left iliac. I did not notice any bruise. You can you can sit up now for me. Okay, now I'm gonna ask you some questions about the abdomen. So, how is your diet?
Okay, I think, I don't know, Whew, I like food.
Do you eat your vegetables and your grains?
I drink my vegetables, if that makes sense.
enough milk?
So yeah, maybe eating some cereal.
Okay, also about the abdomen, do you have any pain in your abdomen at all? No?
Mm-mm.
Any change in your bowel movement?
Mm-mm.
How would you say, is your bowels regular?
Yeah.
No, like blood? How about urine?
Nope.
No urine,
All
okay.
good here.
No previous pregnancies, no nothing, no?
None of that.
Okay, now I'm going to assess, well, I'm going to palpate your pulses. So I'm going to start with the radial. Equal by that a +2. +2. I'm going to do your capillary refill. You refill in less than 3 seconds, and I would do the femoral pulse, but for the purpose of this video, I'm not going to. Now I'm going to do the palpatio. Can you lift up?
Yeah.
Thank you. Okay. So. Okay, +2. I just do wanna, as I'm moving down, of course, no signs of edema, just one to the touch. Patient does have their leg shaved, but you can see the hair follicles and they seem to be evenly distributed. Now I'm going to go to the posterior tibial. +2, and the dorsalis piece. +2, okay. For this one, I'm going to have you push, pull on your toes, okay?
Alright.
Resist. Okay, I'm gonna push. Alright, now you push. Okay. No limitations in range of motion of the legs. Can you go like this? Inversion? Exversion? Can you lay down for me so I can leg raises? Okay. And then your knee. Okay. Other side. Okay. So, you sit up for me. Okay, inversion. Okay. Okay, I'm going to, could you scooch yourself a little closer to the table? Okay, I'm going to push down and then you try to lift up your legs, okay? Okay. Can you brush your heel on your shin for me? Other side for me, please. Okay, can you, okay, now I'm going to do the Babinski twist. Okay, so you might feel ticklish. Okay.
Let me brace myself.
And then I'm going to do sensations. So, you tell me if it's soft or sharp, okay?
Oh, what's up? It's okay.
Okay. And then over here,
With the shirt.
okay, they have sensation in their feet. I'm going to assess for your capillary refill time. Even though their nails are painted, you can still assess by looking at the skin. So it's less than 3 seconds, okay? Now, could I have you stand up for me? Can you walk around the room?
Yeah. Alright, I'm gonna walk this way.
Okay. Patient does not appear to have an impaired gait. Their arms are swaying. I'm going to do the Romberg's test. You stand up, sit down, close your eyes, and stand still. No signs of swaying. Okay, open your eyes now. Sorry. I'm going to do the whisper test, and I got you up. You tell me what you hear.
Pencil?
Uh-huh.
Pen?
Now can you start right there?
Oh,
Can
sorry.
you start there and touch your nose. Like this up. Okay? Okay, now I'm going to instruct you to perform some motions. Abduction, 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 yes. Oh, sorry. I should have told you to mind your surroundings, okay? And you flex for me. Okay, so there was no limitations in range of motion. Now I'm going to have you push and pull. I'm going to push, grasp my fingers. And then I'm going to push and you resist. And now you. Again, no limitations in range of motion. You can sit down now. Okay, well, do you have any questions while I continue for this assessment?
No,
No.
no questions.
Okay, well, I'm going to document my findings and let the doctor know.
Alright,
Okay.
thank you.